I'm Nicki Smith. I'm one of the APRNs at Methodist Women's Services here in Henderson, Kentucky. I was a labor nurse for 10 years, and that was my pride and joy, because what better job could you have? And then when my diagnosis came for cervical cancer, I took it as my personal mission to save women and do the best that I could to save someone from going through what we went through personally. With cervical cancer, typically it's asymptomatic, so you don't always have symptoms until it's late in the game. If you have a positive human papillomavirus test, then that accounts for almost all cervical cancer diagnosis. So that's your main risk factor. The next one is if you have a partner who has had multiple partners and you've had unprotected intercourse. Again, HPV is spread through skin-to-skin contact, so not always just intercourse. If you've had babies before 17 years old, puts you at higher risk. If you've had more than 3 children, that puts you at a higher risk. Smoking doubles your risk. Oral contraceptives for greater than 5 years puts you at higher risk. There's several risk factors that put you at risk, but there's several ways to prevent it, and to combat it. So we just have to be diligent with our screenings. For some reason or another, data doesn't say exactly why we can't fight that virus, but there are people like me that don't fight it, and then it can change things, and it did change things for me. The Gardasil now is amazing, and so it's recommended for all of our children. You can start that at 9 years of age, so up until 26 years old. So if you get it prior to 15 years old, then it's 2 injections. If you get it after 15, then it's 3 injections. So that is the most amazing thing that can happen, and it's for females and males. If all 12-year-olds in the United States were to get the Gardasil injection, that would save over 200,000 cases of HPV. So if you get the vaccination, then you're less likely to progress into cervical cancer. 40 years ago, it was the leading killer in women as far as cancer. Now it's not even in the top 10. So amazing that screening has done that. So just women being compliant with their screenings and getting their pap smears, and the providers being aggressive with treating any abnormal pap smear that we receive has really combated the numbers and brought them down significantly. This is something that is so easy to catch before we get to that point that we lose our lives to cervical cancer. So as long as we adamantly stay on our screenings and come in and just get a simple pap smear, then that's the easiest way to combat this disease and catch it before something terrible happens.